first. Okay. Hi everybody, we are from Common Ambition Bristol, and as many people have said today, it's a brilliant thing to be here and to be recognised, and so many amazing things have been going on that we've seen today, so it's really special. Common Ambition Bristol is a community-led initiative to develop and deliver interventions to reduce HIV and inequities experienced by people of African and Caribbean descent, specifically in Bristol. Now, the project was set up because there's a recognised disparity in HIV experiences from people of African Caribbean descent, and also higher rates of HIV in Bristol than the national average, also a higher rate of late diagnosis, so it was felt really important to stage this intervention. There are 4 main aims established at the start of the project. These were increasing knowledge and reducing HIV stigma, increasing uptake of HIV testing, and also increasing uptake of wider sexual health services. Now, it was set up as a partnership working, and as you can see, we've got many branches. We've got community partners, so that was Brigstow, which is a HIV charity in Bristol, and African Voices Forum. And then we've got our service partners, which was the University Hospital of Bristol, Unity, which is a sexual health service in Bristol, and then the Bristol City Council. And then we've got the evaluation partners, which was the University of Bristol. So they were divided into 3 main groups: the project delivery group, who co-produced and delivered the interventions with the aid of the sexual health services; the project advisory group, who supported and facilitated the workings that was going on; and then the evaluation group, who were establishing what was working well and what could be developed further. And everything came together to make testing more accessible and more inclusive.
Continuing from where she stopped, we implemented several interventions and each of them have been designed to address specific aspects of HIV prevention and care. So I will be talking through few of them today. The first one is the multimedia resources, and we developed a comprehensive CAB website with easy to understand HIV information and myth-busting content. We also created visually appealing posters and flyers distributed throughout the community. We produced myth-busting film addressing common misconceptions about HIV. We've also utilized several social media platforms to reach the younger demographics. The second intervention is the community outreach. This is where CAB members, Common Ambition Bristol, also known as CAB, members of the team conduct weekly visits to over 30 African and Caribbean heritage-owned businesses, and this includes barber shops, hairdressers, and the local African stores. And in this visit, they engage in one-on-one conversations about sexual health, HIV testing, and PrEP. And PrEP stands for pre-exposure prophylaxis. It's a medication that HIV-negative individuals take to prevent themselves from acquiring HIV. And they've also distributed condoms and HIV self-test kits, making these tools readily available to the customers and the clients. They've also provided information on where to access further sexual health services. We have organized several targeted health promotion events that are tailored to specific groups such as students, women, and men. These events are organized in such a way that we offer comprehensive information, again, on sexually transmitted infections, HIV, the testing procedures that are available, and PrEP. These events have created safe space safe spaces for open discussions about sexual health. And the last intervention that I will be talking about today is the dedicated clinics. We have 2 dedicated African and Caribbean community clinics in 2 locations in Bristol. And these clinics have been staffed with trained community members and, sexual health nurses, and this to just help foster a sense of trust and understanding within the community. These clinics offer walk-in HIV testing, eliminating barriers of whether you want to whether you need to schedule an appointment. You can just walk in and get your testing done. And in the clinic, they offer personalized advice on sexual health and HIV prevention. The survey that have been administered to people who have attended the clinic is being displayed on the screen. And if you look at the long green bars, it shows that majority of our patients have indicated that they were satisfied with the treatment and care received. Also, interview data from this same people is being displayed here as well. And they said that there's no need for appointment. Most of the feedback have been overwhelmingly positive as well. And the way we've done this is by being consistent, referring back to the weekly visits to local businesses, and also being visible. This is where we wear CAB-branded T-shirts, we distribute CAB-branded resources, the condoms are branded with our logo, and we've adapted to the different needs of the businesses. This is in terms of opening busy period and also trying to busy period and just not interfering too much with the business schedules. And this has helped us to establish trust within the community. In conclusion, CAB has demonstrated the power of co-production in creating equitable and accessible HIV services. We are now working towards getting CAB commissioned as part of the main sexual health service in Bristol to ensure its long-term impact. And if there is a bit of time, I would love to read the quote that is being displayed here. It says, "Common Ambition is an improvement because at least they are going out and letting people know that you can access this medication PrEP. I've never really gone to the local doctor, so I like this." Thank you for your attention, and I would like to acknowledge that this project has been funded by several partners. Lots of logos have been displayed here on the screen showing the power of co-production in helping to drive testing rates in Bristol. If you scan the QR code that is displayed on the screen, it will take you directly to our website to get more information about the work that we are doing. Thank you once again, and we're happy to answer any of your questions.